Welcome, everyone. I'm Melissa from the team here at Let's All Talk Menopause, and we are delighted that you're joining us to learn more about how you can thrive during your perimenopause journey. I'm especially pleased to welcome you to a special edition of tonight's program, which is part of a medical education series, Managing Women's Health in Menopause, courtesy of an educational grant supported by Astellas Pharma Global Development and Bayer Healthcare Pharmaceuticals. The clinician education components are being presented on menopauselearning.com. And Let's All Talk Menopause is delighted to be presenting the patient outreach component. I would like to thank Dr. Holly Thacker, the chair of Managing Women's Health in Menopause, and recognize the work she is doing with speakingofwomenshealth.com, a wonderful resource for patients that provides an abundance of information on women's health issues. So thanks to the grant tonight, I am pleased to welcome Dr. Tara Iyer to speak on the topic of menopause and weight management. Dr. Iyer is a board-certified family medicine physician specializing in women's health, menopause care, and weight management medicine. She received her MD from Rutgers Robert Wood Johnson Medical School and completed her residency with an obstetrics and women's health track at St. John's Hospital Family Medicine Residency in Denver, Colorado. She then completed a 2-year specialized women's health fellowship at the Cleveland Clinic Foundation. Dr. Iyer is also board-certified in obesity medicine and is a NAMS certified menopause practitioner. So yes, we only bring you the most educated practitioners to help us, which is great. So today, Dr. Iyer will be helping us understand how and why menopause impacts our weight management strategies. And as always, we want you to be part of the conversation. So have your questions ready, place them in the chat, and don't forget to please keep them general and non-specific in the interest of confidentiality. And with that, welcome, Dr. Iyer. Thank you so much for joining us this evening.
Hi, Melissa. Thanks so much for having me. It's so great to see you.
Yes, thank you. So we're going to talk about what I refer to as the dreaded weight gain that tends to creep up on us during perimenopause. And I always say peri/menopause because it's menopause, it's definitely creeping up, but we do notice during that perimenopause phase, a lot of shifting as well as our hormones start to shift. So maybe we could begin talking about how this shift in hormones can cause this weight gain, this bloating, this body mass shifting. What's happening in our bodies that's making this happen and that's giving us less control?
Absolutely. And it is funny that you mention it or say that you start to notice it, or you hear women say that they start to notice a shift even in perimenopause. Now, actually, the data shows there's almost a more significant shift in perimenopause in terms of weight and progressive weight gain than there is actually in menopause that's hormonally driven, or specifically the hormonal components. So there's a lot of changes happening in the body as we get older. And certainly, especially as we get to the 4th, 5th, 6th decades of life, we see changes just that happen with aging, and then certainly changes that have to do with other factors that have nothing to do with our hormones. What's your lifestyle like? What are your stress levels like? How are, at that time, we tend to be the busiest we ever are, right? So, it tends to be that some of the things when you're prioritizing work and kids and this and that, yourself tends to go by the wayside. So certainly there are other factors that can contribute to how a person's body changes around that age. But in specifically regarding hormones in particular, we actually see, a more severe progression or increase in weight in perimenopause as opposed to menopause itself. Thinking kind of the thought process there is that hormonal fluctuations are so wild, and honestly, people have pretty severe symptoms, which really contributes to their overall well-being in perimenopause, and then certainly in menopause. But the lack of estrogen itself does also lead to an increase in total body adipose tissue, or fat, generally speaking, and a redistribution of where we tend to hold it. So I'll often have patients come in saying, I used to be sort of pear-shaped. I used to hold my weight all across my body. I used to hold it just in my thighs. And now all of a sudden I have what feels like a tire around my midsection, or what I felt like I had when I was pregnant or postpartum. So we do see that shift, and that's backed up by the science and the data there. Lastly,
that menobelly, as we like to fondly call it, is really backed up by the estrogen. The lack of estrogen causes the fat to shift.
Absolutely. So in terms of where we store our fat, there is a shift that occurs with hormones. But I will say in perimenopause, there's dual things happening. Sometimes your hormones, your estrogen, for example, is very high, which can lead to sort of that bloating, water retention, which sometimes people experience or associate with, a wider midsection, as opposed to when those levels are low, and certainly after, when we're in menopause. Postmenopausal women experience actually more fat around the midsection. And then also, I do want to point out, just with aging in general, but also what comes with losing estrogen, generally speaking, is that we see a decrease in lean muscle mass.
Mm.
So the amount of muscle on your body goes down, which that directly affects what we call your metabolism, your basal metabolic rate, or what people classically think of as metabolism. So sitting here having this conversation, even if you didn't change too much, you would be burning less calories than we would have if we had this conversation 10 years ago.
So actually, that's a great point, though. So the metabolic rate, I mean, we all talk about metabolism, but what exactly is metabolism? How does it function, and why does it slow down?
Yeah, certainly. So, in terms of what we generally speak of, or when women talk about metabolism in general, I feel like I used to have a fast metabolism. I used to have a slow metabolism, or now I feel like I have a slow metabolism. What we're really talking about is your basal metabolic rate, or your energy expenditure. Essentially, it's sort of a reflection of your energy expenditure throughout the day, and that can be different based on various factors. It's different based on how much total lean muscle mass you have on your person, what's your total weight, what's your height, and then certainly other environmental factors.
So as you age and you have your hormones start to deplete, your resting metabolic rate, if I'm getting this correctly, slows as well.
Absolutely.
Okay.
Yeah. One of the direct components that sort of reflects what that rate is how much lean muscle mass you have. So as that decreases, so does your resting metabolic rate.
And do we know why, other than the fact we know it's due to the hormones, but do you know why it decreases? Like what's happening in the body that all of a sudden says, hey, because I know just from talking to people that, I work out every day, but I can't build muscle like I used to.
Yeah, and certainly part of that absolutely is hormonal, I would say. And that's kind of across the board. We know that estrogen in particular has a lot of properties in the smooth muscle and in lean muscle, generally speaking. And that as it goes down, there are so many functions of estrogen in muscle tissue. So as we lose it, it is really important. It does have an important function in maintaining lean muscle mass. So does testosterone, actually. And many women also lose testosterone in the postmenopausal state, or see a reduction there as well. So there's that. And then there's also just general aging and the other factors that we mentioned.
Got it. So as much as we know that estrogen impacts all of our organs, it also impacts our muscles and our tissue as well. So,
Absolutely.
so I guess the question I have to ask is, if it's all due to estrogen, if if I'm on estrogen, do I not lose as much muscle mass as I age, or do I lose it because I'm aging, but it's not as much due to estrogen?
Yeah, certainly. So that's a great question. We do see, and there's been several studies that have looked at this. And the way that I counsel my patients too is, if we give you back some hormones, if we start you on hormone therapy, it's not like the weight is just going to melt off magically. Certainly that's not the case. That's not what we see.
No.
But what we do see in the literature is that we can attenuate or minimize some of the effects that the lack of estrogen has caused. So we probably will gain less total weight, gain less of that abdominal fat, and certainly we can retain a little bit more lean muscle. And that has been documented, so we do see that. And then anecdotally, I find that I see from patients all the time, they do end up losing weight, or it's possible certainly to stay neutral. But there's several effects that losing your hormones causes that indirectly affect weight. If you're not sleeping, if you're having terrible hot flashes and night sweats, if your mood has changed, you're feeling depressed, your energy levels are zapped, and you're feeling so stressed and frustrated, it's really hard to work out, to focus on your diet, prioritize those things. Your cortisol levels can remain high if you're stressed all day. That makes it really hard to maintain a diet when you have such an increased appetite and an increased drive for, carbohydrate foods, or what we call kind of those cheap foods. So in turn, treating those symptoms, many women do find that it's easier to lose weight because they can actually, commit to those lifestyle changes that we know will work over time.
I see. And you had talked a little bit about, the chronological aging versus the hormonal shift. So it sounds like you need to take a really integrative approach to figuring out why the weight gain's coming on. So how do you go about sort of doing that assessment to understand, is it really hormonal? Is it really just because I'm getting older and this is just life? Like, how do you do that assessment?
Yeah. So that's a great question. I think that we tend to take sort of a full spectrum approach or a really holistic approach and look at different facets of people's life. Certainly, in regards to menopause, I want to hear about every symptom you might be experiencing and what changes in weight you had prior to maybe your first symptom in perimenopause or the first time you started having irregular bleeding up until, the point that a person's at when they come in my office. And then in terms of generally speaking for weight, what are people's diets like? What is their exercise regimen? How much are they sleeping? How much water are they drinking? What are their stress levels? Is that managed? Do they have any other medical conditions that could potentially be contributing externally, completely separate from sort of what's going on? Are they taking any medications that potentially might be leading to weight gain? So there's a lot of different questions that certainly need to be asked.
It sounds like it. And it's interesting because you mentioned water, and water has come up a lot in people sending in questions, just basically saying, like, there's the water hack, where you wake up and you drink a full glass of water and that's going to help you gain weight. There's the, 64 ounces a day. Like,
Yeah.
what is the evidence show that you really need to think about when you're trying to think about water consumption? I mean, what's the recommendation?
Yeah. So what I typically recommend is about 3 liters a day for weight loss. And I would say too that 64 ounces of recommendation, that's for general health. That's not particularly for weight. That's kind
Okay.
of what every primary care doctor should be saying to a patient. Generally speaking, how much water does a person need in the day? But it doesn't have to do, it's not sort of based on what a person's weight is, for example, or what their weight goals are. And then the other thing that I would say is that um, in terms of waking up in the morning and drinking water, we often wake up in the morning and are dehydrated. So I actually do recommend that to a lot of my patients. And you may even find that you feel better in terms of mental clarity, in terms of function and energy, just from that alone. I have had some patients who have started doing that and they find they don't necessarily need their coffee or don't reach for their coffee as quickly in the morning. But again, that's per person. And then the other thing I would say that's really important is some of the signals get mixed up between when are you thirsty and when are you hungry. A lot of times people interpret an I'm thirsty signal really as I'm hungry, when in all they really needed was to drink some water. So in terms of hacks or tricks that sometimes I think people read online or hear about, when people say you should have a glass of water before you reach for the snack, it's really to satisfy that thirst cue that you could potentially be interpreting as a hunger cue.
That's actually really interesting that you're not really interpreting the cue correctly. And what is it that so much water? I mean, I understand that water quenches your thirst, it hydrates your cells, but 64 ounces of water a day for someone that doesn't drink a lot of water is a lot of water, right? So what is that doing for your body? And then if you go to the 3 liters, and I unfortunately I can't do ounces to liters, forgive me, but once you go to the 3 liters and add even more,
Mhm.
what's that doing? Is it helping you speed up your metabolism? What's it really doing for your body?
Yeah, it's not as much that it particularly affects your metabolism in the way that we sort of describe if you drink this much water, you're going to be burning more calories than if you didn't drink it. Certainly, honestly, your body needs that much water, right? You function better in terms of kind of cognition, in terms of energy, in terms of fatigue, in terms of decreasing headaches. There are a ton of health benefits. People will notice too, if you drink sufficient amounts of water, you might notice your skin's glowing. You may have other sort of downstream side effects in terms of appearance, even besides that. But in particular, in terms of weight, generally speaking, and thinking about those hunger cues, thinking about if you drink water with meals versus if you don't, if you're staying full on water, when we're putting something in our stomach, whether it's water, whether it's food, actually, and just the volume there, generally speaking, does really change some of your hunger hormones. So there are some changes in those hormones in terms of I have something in my stomach now, I need to put out less of the hormone that's telling me to eat, and I actually have more of that hormone that's telling me I'm full.
Interesting. So I'm eating, I'm full, I'm gaining weight, I'm changing the way I store fat. You mentioned that there are different types of fat, right? So as I'm thinking about managing fat, I'd love to understand a little bit, what are the different types of fat and how does that, how do they change over the course of perimenopause, like in terms of how they react to things that I'm doing and things that I should be thinking about? Right.
So when you say the different types of fat, do you mean what we were talking about in terms of distribution, in terms of abdominal fat or visceral fat versus peripheral fat?
Yes, I just want people to understand that like the fat on your abdomen is different than the fat in other parts of your body, correct?
Absolutely. Yeah, the main distinction there in terms of peripheral fat, meaning fat that's not located, when we say visceral fat or abdominal fat, we really mean the fat that's around all of our organs that's in our abdomen, right? So the fat
Okay.
that's around all those organs in kind of between sort of your hips and up towards your chest. That's what we talk about in terms of central or visceral fat. When we're talking about peripheral fat, we mean all the other fat, right? What you can see on your legs, what you can see on your arms, everywhere else. And the reason there is a distinction, the reason it matters and makes so much of a difference is because there's a lot of worse health outcomes associated with increases in visceral fat, that fat that's right around the organs. So the fact that there is a shift there really coincides with some of the other health risk factors that we see that occur during the menopausal transition, a higher increased risk of cardiovascular mortality or cardiovascular disease and those ramifications.
I see, because there was always that if you've got that big quote unquote beer gut, that there was more of a likelihood that you're a candidate for cardiovascular disease, and that's because that's the visceral fat that's surrounding all your organs.
Yes.
Gotcha. Okay.
There have been
So
studies done that if you take two people who are the same weight but have vastly different sort of waist sizes, one with a much larger waist size indicating more sort of visceral fat, and one without, even though they weigh exactly the same, the person that has that increase in visceral fat is going to have much worse cardiovascular outcomes, even at the same weight.
and is visceral fat, from what I understand, it's harder to lose or get rid of?
Yeah, so certainly I think that is it sort of depends, I guess, as we get older, and it certainly depends on the person.
Okay.
But yeah, I do believe that can be a little bit more difficult to lose in many people.
So it seems a little unfair that as we age, our visceral fat shifts and is more likely to accumulate, yet that's also worse for our organs and harder to get rid of. So somebody's really not being nice up there, right? So knowing that all this is likely to occur in any woman, if we are lucky enough to get to a point where we're perimenopausal and going through menopause, how does diet really come into play? Like, what are the real evidence-based facts about how diet can really help manage this without saying go vegan, right? I mean, for the average everyday person that's sort of looking to eat healthy, but also still enjoy life.
Absolutely. I mean, diet, I think, is one of the most prominent factors, right? When we think about lifestyle, generally, the changes that we can make that are most impactful, we always start with diet and exercise. Specifically about diet, I mean, there's a lot of information out there about different fad diets and then specific diets that might benefit you if you're in a special population. For example, if you have high blood pressure, you might benefit from a lower salt diet. If you have cardiovascular disease, you might benefit a little bit more from a Mediterranean diet. If you're diabetic, you want a low glycemic index diet. And then there's sort of fad diets, right? The ketogenic diet, Atkins diet, a lot of different information out there. But really it comes down to kind of the basics. What matters most is caloric restriction. So how many calories are you eating in a day? And what is the food quality? So you want whole unprocessed foods. You want nutrient dense foods, lean proteins, lots of vegetables, lots of healthy fiber. That is really what it comes down to. And at the end of the day, the macronutrients that matter the most are protein, certainly, because protein is the building block for those lean muscles. And if you lose weight, right, if you're not eating adequate protein, you're going to muscle along with fat. We want to make sure that you are retaining as much muscle as possible, at least have the building blocks to be able to do it. And certainly if you're trying to build muscle, you absolutely need adequate protein. So higher protein and sufficient protein from great sources really matters. Fiber content really matters. And then trying to limit processed foods, generally speaking, and then portion size.
And portion size. Interesting, we just got a question that came in basically asking that since the food pyramid is not the ideal model anymore, and the Mediterranean diet's been on the forefront of weight loss, and just today on the news, help with decreasing dementia, does this also help with retaining more lean muscle mass, this Mediterranean diet?
So in particular, the Mediterranean diet doesn't give you macronutrient breakdowns typically. It doesn't tell you, you have to eat this much protein, you have to eat this many carbs, you have to eat this many fats. It gives you sort of a model of what to eat, which is pretty much coincides with what we're talking about. Lots of healthy fats, lots of vegetables, lots of lean proteins. But really, what we want to do, so absolutely you can eat the Mediterranean diet and still achieve all these goals. 100%. I think it's a fantastic diet and a great model for patients. But
Mhm.
it is important to make sure, even within the constraints of that diet, that you are getting adequate protein.
Okay. And then I guess the other question that then came in is there a calorie goal for perimenopause or menopausal women, or a protein goal that you could share?
So I would say the minimum for protein should be probably about 80 grams per day, generally speaking, and that's at most weights. But a calorie goal specifically has to be individualized per person. And so that is something that you would want to talk about with your doctor or weight management physician, certainly. But generally speaking, in an ideal world, somebody who's trying to lose weight, we want to do about zero point 0.8 to 1.2 grams per kilogram, so not per pound, per kilogram of protein a day. But in an easier way to put it, most people are going to fall into at least 80 grams of protein a day, minimum.
80 grams. That's a lot of protein. And how do you feel about getting your protein? Well, I mean, I know you said a lot about, whole foods, not processed foods, but what about protein powders? Are they acceptable?
Yeah. No, I actually really like protein powders. I know that they do fall into the category of processed foods, so I generally advise most of my patients to try to find cleaner proteins, certainly, that have less kind of additives and other artificial ingredients. But I think protein powders are a great way and a great addition to a diet, especially because, like you said, 80 grams is a lot. I have a ton of patients who intermittent fast. They're only eating 2 meals a day. It's hard to pack in 40 grams of protein in 2 meals or more without the use of some type of protein supplement like a protein powder.
Yeah, that makes sense. Let's move into the whole diet versus exercise. I mean, lately you hear a lot of, it's 85% diet. Like, you need to exercise for your cardiac health and et cetera, but it really comes down to diet. Is that factor or myth?
That is fact, unfortunately, because I do have some patients who exercise like crazy and sometimes still don't see the weight budge. And that old adage remains true. You can't sort of outrun or outwork an unhealthy diet. You
Okay.
know, in terms of 80/20, those exact percentages, I don't think you could ever say those are exactly right. Those are absolutely going to change per person. Some people respond better in terms of exercise or are more hyper responsive, more responsive, and that is a way for them to really change their weight, versus some people that works less. They can do a bunch of cardio on a regular basis and they come in and they're still like, my weight is not budging. So certainly how much in terms of those percentages varies per person, but no matter what, no matter the person, if you do not have a healthy diet, it's going to be very difficult to lose weight at this age group.
And it sounds like there's no end in sight to this, because once you hit menopause, I mean, unless you're on hormone therapy, your estrogen has been depleted. You're always going to have to be battling the bulge, I guess is the best way to say that, right? It's not like all of a sudden, your body shifts again. Once you hit menopause, that's sort of where you're at. Is that correct?
Yeah, that's true. I would say so. Here's the thing though, in terms of how much weight we see on average, studies have looked at this. In particular, there was a really, great study, very powerful, lots of women, called the Study of Women's Health Across the Nation, that looked at women ages 40 to 55. So we're talking right in that perimenopausal range, and showed that they had an average 3-year increase in body weight of about 4.5 pounds. So that's not a crazy amount. That's not so much. But certainly we think that those shifts, obviously, lifestyle, everything we talked about, but absolutely there's a hormonal contribution to that. But we see less weight than that, typically due to hormones after menopause, when your hormones are consistently low. But certainly we see other things impacting weight, other things impacting lean muscle mass as we age, even more so. And then there have been follow-up studies that say people gain about 1.5 pounds a year in their 5th, 6th decades of life. So Certainly, I would say that hormonal change that we see, that we really worry about, that we talk about in perimenopause and through the menopause transition, it's not like you'll consistently gain that much forever going forward. But if you don't make lifestyle changes, if you don't change anything, there are other factors at play that might make it much more difficult to lose weight or might cause you to gain more weight.
Yeah. So with that in mind and talking about lifestyle changes, let's talk about alcohol for a minute. Right? I mean, because over the years, we've seen the study, a glass of red wine at night is good for you. It's not good for you. You should, you shouldn't. But we also see a lot of, if you want to lose weight, the first thing you need to cut is alcohol. Can you explain why that is?
The answer to that is fairly simple in that alcohol is empty calories. There's zero nutritional value and it adds a lot of calories. So someone who's on, say, a low calorie diet, generally speaking, maybe 1,400 calories or 1,200 calories, which would be very low in calories, right? Compared to what somebody at a maintenance calories who's just trying to maintain their weight would be, which would be much higher. But say you were on the absolute lowest calorie diet that somebody would recommend, generally speaking, that'd be about 1,200 unless you want a supervised diet program that went lower. Alcohol, one glass of alcohol is generally about 110, 150 calories, depending on what you drink. So if it's something like a spirit, 1.5 ounces tends to be about either 1 or 1.5 ounces tends to be about 100, 110 calories. If we're talking about a glass of wine, it tends to be about 150 calories in the vast majority of cases. That's a lot in somebody who has such a low calorie diet, right? And that's a lot, especially of room in your day for something with no nutritional value.
Right.
At the same time, often we see sometimes it's hard to stick to one glass, right? Some people might have 1 or 2 or 3, that adds up. And then you might not feel motivated the next morning if you're feeling the after effects. It's easier to kind of consume, unhealthy foods either that night or the next morning. And it also, your motivation, your drive to go work out and get up if you're not feeling too great is going to go down.
Yeah, no, that makes a lot of sense. So with that in mind, what are your nutrition non-negotiables?
So my nutrition non-negotiables, what I would say is adequate protein, 100%, and adequate fiber. That's something that really goes by the wayside a lot that I think is very important in weight. And certainly most people, generally speaking, in the United States do not get enough fiber in their diet. So those are the things that I tend to tell patients a lot. I would say in terms of things not to do, if we're talking about what not to do, I really emphasize please don't drink your calories.
Okay.
So alcohol is a big one, but also things like Starbucks drinks, sugary drinks, juices, sodas, all of those. It's so easy to put down 1, 2, 3 very quickly. And that's a lot of calories for very little nutritional value in the vast majority of cases.
Yeah, that makes a lot of sense. Somebody's asking if we could help them convert the 80 grams of protein to ounces. They're doing the calculation and getting 2.8 ounces. I don't know if you know the ounces in terms of grams instead of grams.
So it would depend on there's not a strict calculation there. It would depend on the kind of food.
I see. Okay.
Right? So it would be how many ounces for, say,
chicken versus
exactly.
salmon versus what have you.
There's a different amount per gram per type of food.
Gotcha. All right. So we have to find a conversion calculator that we can share with everybody, which we can easily do. What about supplements? Do you recommend supplements? Are there certain ones that you think are definite need?
Yeah. So I wouldn't say that there's any supplement in particular that if you started taking it, there's a lot of evidence, against placebo that it would make you lose weight. It would help with weight loss. That in particular, I don't think that there is, great data out there for. Certainly there are some supplements out in the exercise world, in the weight loss world, that have a little bit of data behind them in particular instances. But there's not a magic bullet type supplement where if you take it, you can keep doing the same thing and weight is just going to sort of pour off.
Yeah, that magic bullet just doesn't exist, does it? Someone's going to have to come right now. We're going to actually have to do the work. Speaking of doing the work, what about intermittent fasting? You mentioned it a little bit earlier. I'd love to talk a little bit about that just because there's so much on social media right now about, 14-hour, 15-hour, 16-hour, based upon your body shape, your size, what have you. What's the real skinny behind intermittent fasting?
Yeah, so certainly intermittent fasting, I have seen be very helpful in many women, and especially at this age. And it does carry more benefits just than potentially weight loss. So I do think that it absolutely is a good option for some patients. I will say I have also had patients who don't feel like it was helpful for them, who didn't feel like it worked well for them. And the data is a little bit mixed. There has recently come out studies saying that for the same amount of calories with intermittent fasting, we didn't see too much of a difference, though there's studies saying the opposite. So I really do think it takes a case by case basis to tell. And I think there's more data that supports it's more about the timing of when you eat. So, for example, intermittent fasting has more supportive data that it is more effective if the timing of when you eat is earlier in the day. So, the more that you can mimic when does the sun come up and when the sun comes down, you're only eating in that window and you're not eating very late at night. The earlier you finish eating, the earlier you finish your calories, the more effective it is.
But isn't that more of a 10 to 12 hour window then, as opposed to just that 8-hour window of eating if it's sun up, sundown?
So I would say to focus on that area. And if those are the hours that you're awake, fantastic. But in terms of the data for intermittent fasting, absolutely, you're right. There's some studies on 12 and 12, though I don't think that's particularly a great window. Really, the most evidence is for 16-8, so eating 8 hours, but you want to shift that as early as possible.
Got it.
And then 5 to 2, which is more about eating regularly on 5 days and 2 days having a much lower calorie
No, 5 to 2 also.
consumption.
Okay. So, and if someone were to try intermittent fasting or 5 to 2, how long do you need to give it to really say, hey, this isn't working for me, or oh, this is? Is it 2 weeks? Is it a month? Like, what do you typically recommend to patients to try?
Yeah, for most patients, and I wouldn't say, certainly there are studies and they have given, they looked at patients over 3 months, they've looked at patients over 6 months, they've looked at patients for longer amounts of time. I particular advise my patients to stick with anything for at least 3 months. I think that gives a
3 months.
really good idea. The reason I say that too is because realistically speaking, say you're doing something for a month, say you're doing something for 2 months, right? There's going to be times in there's a birthday, there's a, stressful work project, there's, a family vacation. There are things that are going to disrupt it. And whether that's for a day or 2 weeks, who can tell with how busy people's lives are? So I like to say 3 months to get a really good idea of you're just living your daily life and you're trying to apply this. What does that look like for you? And how did that impact you? What are the effects?
That makes perfect sense. And what about carb cycling? That's a question we just got.
Yeah, certainly I would say there's less evidence, and it definitely depends on what type of diet in particular has worked for you. It depends on what your fitness goals are. It depends on what your weight loss goals are. So I would say that's more of an individualized, decision between nutritionist and or physician and a patient. A lot of the information out there that might be effective for you that is in the media, that's kind of talked about a lot. Unfortunately, really these decisions need to be individualized based on a person. We need to hear what worked for you in the past, what do you typically eat, and what then from that we can extrapolate what is going to work best for you.
I see. And what do you make of all of this? I shouldn't say all of this, but of these different weight management companies that offer the DNA testing to develop the ideal diet for your individual DNA. Is there anything to be said for that?
Yeah, I would say at this point, there's absolutely no data to support that, unfortunately. I think, while certainly a lot of the testing, may tell you you may be more sensitive to certain foods, several times, and this is true in the allergy world, this is true in the GI world or gastrointestinal world, this is true in functional medicine, this is true in weight management. Certainly those tests can tell you if you're more sensitive or quote unquote allergic to things, but the real test is how do you feel when you eat it? Because plenty of people are fine and plenty of people will notice they feel a little better with things that weren't on the list versus are on the list. So there's absolutely no data to support that. I would say the thing to focus on is the quality of your food.
So focus on the quality of the food, and then I guess think about what about the whole idea of, you do a cleanse or you do a fast, and then you put food groups back in one at a time to see what you're quote unquote allergic to or sensitive to. Does that have any impact on weight gain?
No, so that is probably the number one way to figure out if you have a food sensitivity that's causing you increased bloating or causing you sort of inflammation or poor responses. The number one way to figure that out is an elimination diet. And I would suggest it if you feel like there are particular food triggers that really poorly impact your body, and so the issue is, or the thing that's difficult is to really do it, you have to remove that food for quite a long time. I would say minimum a month to get a good trial in. And most people, that could be quite difficult depending on what the food is.
That is a long time, but that is interesting. So here's a question. What advice can you give to someone who is so frustrated after trying so many things and seeing almost no success with many factors, busy work, family, and pre-breast cancer cells, so cannot take any hormones?
Yeah, so the best advice that I would have for a patient like this would be to see a specialist. Absolutely. So there are a lot of times where we have optimized our diet and exercise, and there are other factors at play, whether we know about them or not. There are medications that can be helpful. Some people really do need to change what they're doing, or they've done all the research, they've looked at everything, and they think that they have the best path, but maybe there are changes and tweaks that would be better for them that they don't know about yet. I would say the best advice I would have is to see a specialist 100%. And certainly somebody with precancerous breast cells, depending on what they are, I would say it would be important to get evaluated by a hormone specialist, by a menopause expert in particular, to see if that's actually true or not. Because there's also a lot of misinformation about hormone therapy and how it relates to breast cancer, as I'm sure we've covered in previous talks.
Yeah, no, that is true. So I guess my next question there would be if I'm stuck, if nothing's working. You mentioned, go see a specialist. You mentioned medications, and there's been a lot in the news recently about certain medications that are not prescribed for weight loss, but have now been being used for weight loss, like an Ozempic, or I don't know what the generic name is, and a bunch of others. But are there weight loss medications that are actually formulated for weight loss, and how do they work?
Yeah, so actually the medications that you're kind of talking about, which we call our GLP-1 agonists or medications, that's the brand names being things like Trulicity, like Ozempic. Those were particularly studied in those dosages for diabetes initially. And those drugs have been around for quite a while, right? They've been around for 10, 15 years, potentially even longer than that. But more recently, a few of those formulations have been particularly studied for weight loss. So semaglutide in particular, there's a brand name that is for diabetes, that's meant for diabetes care, but is being used off-label for weight loss, and that's Ozempic. And there's a brand name that is for weight loss in particular, regardless of what your glucose is doing, completely regardless of that. And that is Wegovy. That's the brand name for that.
Okay.
Same with the medication Saxenda, which is liraglutide as the generic, which again comes in a diabetic form and dosage plan and a weight loss form and dosage plan. And both of those are FDA approved for weight loss specifically. And then more recently, there's a medicine that's sort of a combination, because this medication mimics a hormone that is directly related to hunger and how full you feel. So there's a combination medication of different hormones called Mounjaro, which is GIP-1 or gastric inhibitory peptide, as well as that GLP-1.
So most of these medications, they inhibit the hunger, so you don't feel hungry. So they're not doing anything physiologically to anything in your cells. They're not breaking down your fat. They're just making you feel full.
That's exactly right. They influence at the level of the brain and at the level of the gut. They influence how hungry are you, so they decrease appetite, and they influence how full are you, so they increase satiety.
Got it. Okay. Just moving on to a few other questions. What about younger women who experience surgical menopause? Are they then immediately at the same risk of the visceral fat and everything shifting and starting to really think about their metabolism slowing down? Or is some of that also due to chronological age?
So both is true, but absolutely that would occur at a younger age, depending on when you got your ovaries removed. And we do tend to see that those shifts can be a little bit worse with surgical menopause because you completely lose your ovaries, right? So even any estrogen production from those ovaries is now gone.
Yeah. Okay. So they've got to be thinking about the same things we are
Yeah.
at the
And I
older
would
age.
say anyone who, oh yeah, go
Oh,
ahead.
sorry. I was just coming on to the next question, but did you have something else to say about that?
I would just say anyone who's going through surgical menopause, especially early, so certainly earlier than the average age of menopause, which is about 52, but certainly what we would consider early menopause, so earlier than 45, absolutely it's paramount that you talk to a menopause expert about what you can do in terms of supplementing those hormones. It's sort of the gold standard of care, and we really see a lot of downstream side effects in terms of weight, in terms of metabolism, in terms of diabetes risk, in terms of cardiovascular risk, all from losing those ovaries. So it is absolutely important to see somebody regarding that.
Yeah, that is such important advice. Thank you. Because so many women don't even get spoken to about that when they're, post surgery. And it's just so important.
Absolutely.
I find I am bloated all the time. What can I do about that?
Yeah, so certainly it depends on the person, right? What is the reason that you're bloated? There can be a lot of different reasons. It could be in perimenopause, it could be related to hormonal shifts. In menopause at the same time, what is that bloating? Is it related to, what your estrogen is doing? Is it related to deficiencies there? Is it related to an increase in abdominal fat? Or a lot of times people have increased bloating completely related to what they're eating. So there's a lot of things to consider. There's also another thing to consider in terms of what does your diet content look like in salt intake in general, right? The higher your salt intake, the more water you're going to retain. And a lot of people, higher carbohydrate intake, the more water you're going to retain. So it really does matter, even besides certain triggers, right? Some people really have a lot of bloating with dairy, for example, some people with gluten, though that's certainly not as common, I would say, as everyone sort of believes that it potentially is in the data. But there are a lot of different food triggers that can impact how you feel. So there's a lot to consider. I would say the best thing to do would be to talk to a physician about getting advice. When do you feel this way? Are there any triggers? What else is going on? Do you have any other symptoms? It's a lot to figure out.
And would you recommend a food diary in that case?
Absolutely. That's the number one step and going in for the first time to your doctors, already having that information saves you so many appointments. It saves you so many steps. So I'd recommend trying that before you even go for the first time so that you're able to confidently say, no, I ate X, Y, and Z and felt fine. No, I don't need to eliminate those things, or I already tried eliminating these things and nothing worked.
Perfect. Got it. Thank you. Continuing on with diet, I've been hearing a lot about soybeans. Do they help with weight loss?
So soybeans in particular, and there's probably a lot of information in the perimenopausal space and menopausal space about soy. In general, there's not necessarily a correlation with how much soy you ingest leading directly, or a causative relationship leading directly to weight loss, right? Soy potentially has an impact on estrogen, and that's probably more of the resounding factor why people may notice a difference in the perimenopausal space. I would say what's more important is to modulate and regulate those hormones at a more stable level, at an actually adequate level. So that's where I would say hormone therapy would make more of an impact, certainly, than soy ingestion or having an ideal soy ingestion.
And you mentioned earlier on that hormone therapy doesn't necessarily mean that the weight's going to just fall off, but that it might help a little bit with the body's need to keep aggregating all that visceral fat, right? So it just may help make that a little bit easier. Okay.
Absolutely. And it may help with, we say that there's a shift in perimenopause, and a lot of times people are noticing that shift there. And even from the hormones themselves, certainly there is a shift, but that is a couple pounds. So when you notice things like 10 pounds, 15 pounds, 20 pounds, there certainly are other factors just than the hormones. And that's the part that is sort of hard to reconcile. Even though we take this medication, even though our hormones changed, we still need to change those things in our lifestyle and diet, even though that's not the easiest thing to do, unfortunately.
Yeah, no. So it sounds like the advice is if you're seeing more than a 4 or 5 pound weight gain, you can't just keep blaming it on the menopause. You have to sort of look at some other factors as well, as much as we'd rather blame it on something else. I've been lifting heavier weights for a few months now and just seem to be bulking up. Will low weights but more reps work as well? And this is a great question because we hear a lot about, you really need to start lifting heavy in order to burn more calories because muscle burns more than fat. So maybe you could talk a little bit about that for us.
Yeah, so absolutely. I would say the one thing is it really depends what's going on in your diet. So it's hard to say for this person in particular, right? If you are eating a lower calorie diet and lifting heavy and having adequate protein and enough protein, you should be retaining lean muscle mass as well as losing weight. But if you are eating a higher calorie diet and really lifting heavy, you should be putting on muscle and not necessarily losing a significant amount of weight, or potentially, shifting your body distribution. So you might be losing a little fat while putting on more weight. So that really depends, what calories are you eating in your diet. There's certainly nothing wrong with doing lower weights with more reps, but I do think it's more successful to do higher weights as long as the diet is in check.
Got it. And is it true that muscle weighs more than fat? So do you find that people that start doing a heavier weightlifting routine, even though they may be losing some fat, the scale might not change for a while?
Certainly that's the case. And a better way to measure would be, how are your clothes fitting? Have you lost inches on your weight? And that's because of the density, right? Muscle is more dense than fat. And so that is true. And absolutely, that's when I think people need to look at sort of those non-scale goals.
I
Like
love the
weight.
non-scale goals. Yes,
Mhm.
that's the best. Um, are there any health and wellness apps you recommend to make sticking to a diet or exercise routine easier?
So there are so many on the market, and it does depend, I think, why it's difficult for you to stick to something. So in certain cases, right, some people need to be able, they don't have a good idea about what they're actually eating every day, or they think they're eating less than they're actually eating. So in that case, I would recommend something like MyFitnessPal, for example, to be able to track exactly what you're eating, because that's going to be the thing that's most helpful for you. But then in other circumstances, right, people may know exactly how much they're eating. They may be already tracking what they're doing. They have the information, but have these times where they don't know why they are eating out of stress or out of emotional response, or there's other things going on, in which case something like Noom might be more helpful, which is sort of a cognitive behavioral approach to, why am I eating this way? What else? What other healthy habits am I ignoring that I can fix and tweak? So that certainly depends on, per person, what would be the most helpful, individualized for you.
Okay, that's super helpful. Thank you. Um, what about, I have somebody asking about joint pain. They're asking what you can do for joint pain. And I guess I'm assuming that means, are there certain foods that are more inflammatory versus others that we should be thinking about?
Yeah. So again, part of that I would say is individualized per person, similar to what foods cause bloating, what foods cause
Mm,
you inflammation in your body. I would say in part there's that. Secondarily, I would say, generally speaking, for everybody, you want to minimize processed foods. Processed foods are going to add more inflammation to your body than unprocessed whole foods. So in terms of diet in particular, I would absolutely say that. Generally, in terms of weight, right, in terms of joint pain, if you see in perimenopause, and weight generally in perimenopause, reducing joint pain, that is a significant symptom of estrogen deficiency. I have several patients who the reason for their diffuse joint pain is perimenopause or menopause. So that would be worth an evaluation.
mm.
B, the more weight you have on your body, the more stress you're putting on your joints. So any weight loss in turn is going to help reduce stress on those joints. It's going to help relieve some of that joint pain. And then lastly, sometimes women experience more autoimmune issues as they get older, which can also lead to diffuse joint pain. So it would be worth an evaluation if it's more than just one joint. And certainly it would be worth looking at food triggers and trying to eat cleaner and eliminate more processed foods from your diet to sort of see if that makes a difference.
Super helpful. Thank you. What about apple cider vinegar? Is it worth drinking to help with weight loss?
Yeah, so there's not great data on it. I would say if you compare it to placebo, or if you compare it in studies looking at women specifically regarding weight. I don't think that there's any reason that it would hurt whatsoever, but I don't, again, it's not going to be a magic bullet. It's not going to work better if you keep your diet the same and then that's the only thing you change, certainly that won't work better than changing your diet. I would say that it won't hurt, but it's there's not a correlation between, okay, if I have this with every meal, I'm going to see this many pounds off. That's just not.
Is there any nutritional value to apple cider vinegar?
It certainly has some benefits, I would say, across the board. Because it is very acidic, it can help with certain digestion. It can help. There are limited studies that it can be helpful in terms of insulin regulation, but very limited, right? So not, again, not compared to medications, not compared to placebos, not really, not shown to be true again and again and again, not powerful studies. I would say, there's minimal evidence that can be helpful. And certainly we use it, say, in integrative medicine and functional medicine for specific purposes. And some people do get benefit or feel better when using it. And I have plenty of patients who really like taking it, but I can't recommend it as a weight loss supplement, saying that I know that if you take this, we're going to see X, Y, and Z in terms of, your mood, in terms of your energy, in terms of this much weight's coming off.
Got it. So we've talked a lot about weight gain and diet in perimenopause, in menopause. I guess maybe one of the questions I would sort of come to the end with, is there anything women can do leading into menopause? Because you mentioned that menopause is when it really starts to hit, to help stave off the weight gain or the shifting of body tissue?
Yeah, and I would say the best thing to do, and it's kind of the same thought process throughout life, but is start building those healthy habits earlier. If you go in already, having a strength training routine, prioritizing how many steps you take in the day, prioritizing eating the right foods, then certainly having those habits are already be part of your lifestyle can minimize what you would see in terms of ramifications from perimenopause and menopause down the line. I would also say that during that time there tends to be a lot of stress, so already having those habits built in already puts you kind of a couple steps ahead, as opposed to, I'm in this really stressful time in my life and now they want me to focus on changing my diet, now they want me to focus on exercising, I barely have time for myself anyway. So I know we're asking a lot from women at that age. I do think it's easier to kind of try your best to build up those habits ahead of time. Everything's easier said than done, and we completely understand how busy people are. But that's probably the best advice I would say going into perimenopause.
No, that is good advice. When you had talked about the apple cider vinegar, you had mentioned that it can sometimes aid with digestion. And we have somebody asking if there's a concern with acid, if they have acid reflux, is apple cider vinegar something to be concerned about?
So I would also say, if you have acid reflux and you are taking medications versus you're not taking medications, that would be a different decision. So that is something I would talk about with a primary care doctor based on your own health. Are you taking omeprazole or a proton pump inhibitor? Are you taking, famotidine, or, are you taking other medications? All of that would be necessary and helpful before I would be able to say.
Fair enough. And we have one woman in her 70s who's asking if you have any thoughts on Premarin. She's been on them since she was 52. She's had her ovaries removed surgically, her uterus, her cervix, everything. And she's told that she can just continue on Premarin, which is obviously helping with her weight management. Do you have any thoughts on how long you can stay on something like that?
Absolutely. I don't think that there is a duration. What she's being told, I believe, is accurate. There isn't a duration where you absolutely need to stop at this age. It's a conversation with your doctor sort of every year. Am I on the right dose for myself? And is this still a worthwhile medication for me? Do the benefits still outweigh the risks? And we know that it's much safer to be on estrogen therapy in longer terms when you don't have a uterus and you don't need to also take a progestogen or a type of progesterone with your estrogen. So certainly that is a conversation. I have plenty of patients well into their 80s who stay on Premarin or some type of estrogen, the most important conversations to have are, is this still the right formulation? Do I want oral? Do I want transdermal or via a patch or a gel? Is this still the right dose for me? As you get older, that dose might need to be decreased, because as the efficacy at which we metabolize medications changes and our weight changes, and certainly that can be impactful. And am I still happy on this medicine? What's my bone status? Are there other effects? So a lot of different questions, but I certainly wouldn't say that there is an exact time she needs to come off.
Oh no, that's a really helpful answer. Thank you. And we are coming to the close of this hour, so I guess I'll ask if you've got one last thought. What's that one message you want to make sure that our audience takes home tonight?
Absolutely. My message for women at midlife would first off to be able to say, you're not alone. You know, the vast majority of women are going to be going through these same symptoms and struggling with the same exact issues. So don't be afraid to talk about it. Don't be afraid to bring it up with your doctors and ask for help. You know, this is the time to take charge of your health. This is the time to sort of be your own advocate and make changes to age as intelligently as possible and to optimize your health and well-being.
Yeah, no, that's wonderful advice. And thank you so much, Dr. Iyer. You've shared so much really, really helpful information for all of us as we really try to think through what are the best options for us as we think through how to manage weight and perimenopause. But really, you so clearly explained everything that we really, really appreciate your time and really have enjoyed having you here. So thank you.
Thank you. And then the last thing I'd like to mention, and I know we talked about speaking of womenshealth.com, but I'll be talking more on this issue soon on the free podcast available there. So if you'd like to hear more, certainly tune into that.
Oh, wonderful. Yes. We'll make sure everybody goes to, I'm going to put it in the chat right now for anybody that wants to take a look. Just if you go to speakingofwomenshealth.com, you can learn more about what Dr. Iyer is doing, and you can also sign up to listen to our podcast. Thank you. Well, thank you, everybody. We've really had a great chat today, and I think we've learned a lot. We'd like to thank Dr. Iyer, but also thank you again to Astellas Pharma Global Development and Bayer Healthcare Pharmaceuticals for supporting education in women's health. And thank you all for watching and for all of your questions. I hope you will join me next on Tuesday, March 21st for a discussion with Dr. Sharon Parrish about how menopause can impact mood and low sexual desire and function. And please remember that we're not offering medical or clinical health services specific to your situation. If you need help, please contact your doctor or other qualified healthcare professional with any questions regarding personal health or medical conditions. And please don't wait to get help if you need it. And don't forget, you can keep up to date with the latest information about what's coming up in the future by reading our newsletter or following us on Instagram. You can always find us at letsalltalk.menopauseus. And this episode will be available to watch as soon as we come off air, so please feel free to watch it again. And if you like what we're doing, share it with your friends and family. The more women we can help, the better. And with that, I wish you well and good luck taking control of your menopause experience.